All right, good afternoon, everyone. We can let additional members in the room as we go. Just to give you a heads up, we are live streaming this on YouTube. It's not a public live stream as we speak, but it's going to be recorded and then put on YouTube. And the easiest way for us to record it is actually just to live stream it on YouTube on a private channel and then edit it and then put it up. So with that being said, if you do have questions that you prefer to ask us privately, please email them to us and we can discuss those with you. If it's something related to a specific component of your grant that you would rather not share publicly, then send those to us privately. But we have another person coming in. We will go ahead and get this started in just a minute. Okay, welcome to our first of two question and answer grant seekers question and answer sessions. How's that? We're going to just open the floor. You're welcome to unmute your microphone and ask a question, or you may, if you prefer, put the question in the chat and then I will read it out loud and then I will answer the question. So you have two options for how you'd like to do that. I will hide the non-video participants. So if you don't want to be on the screen, you can put your camera off. When your camera is on, you will be on the screen, which will be recorded and later posted on our YouTube page for anyone else who would like to watch the video that was not able to make it today, but would like to learn from the question and answer shared. That being said, I'll open the floor to anyone that has questions. Okay, just one at a time, please. Sorry. That's a classic joke. Had to do it.
Hi, Jason. It's Lynn. Lynn Momberger. I had just one question, and I just wondered if you had any definition that you put to what constitutes a client's inability to pay, or if that's just strictly related to whatever our policy might happen to be.
A client's inability to pay is a fiscal measure, it is not meant to be the only screening device. So if a client does not qualify for services on the basis of their diagnosis, on the basis of where they live, on the basis of some other factor, like, and what I mean by where they live is outside of Winnebago County,
Right.
Then of course that those may be appropriate reasons to refer to other services and potentially not serve that person under your funded program, but you may not solely on the basis of this person does not have the financial ability to pay for the service, deny them for the service. So if you have a sliding scale policy for your funded mental health board program, if somebody cannot afford the bottom line copay, you may not reject their ability to receive service on that basis. Does that
helps
a little bit of clarity?
But then as far as how you determine if they can afford to pay, are there any parameters that are established by the mental health board around what those parameters would be? And so right now we just take a person's word for it and haven't really ever required any kind of proof of income or anything like that. And I just want to make sure that if we were to change that and require people to provide any kind of documentation to verify what their household income was to qualify for the different levels on the sliding scale, that would still be acceptable.
I think that would be a board decision, Lynn. So I would say in that situation, I'd probably want to take your updated policy to the board for a decision on that. I don't think that would be my place to make that decision independently, but I think in general, the value or the principle here is that people are not, when we have this public tax for mental health services, that no one's being turned away because they are uninsured or underinsured. So I mean, you're talking probably about a pretty unique situation and somebody that maybe doesn't have insurance or for that service and somehow also has the financial means to pay for that. So that might just be something we need to take a look at what your policy is, but really the intent is that no one in Winnebago County with this type of local fund should be denied the services funded by the board because they don't have insurance or underinsured. And so, you know, I hope that's helpful without making a definitive statement as to whether or not that will be allowed.
Okay, thank you.
Any other questions? Check the chat. Okay. Lori?
Yep, I have a question. So we have a couple of organizations that we will be collaborating with. Is that something we should go through? Should we go through the collaboration tool, or should we just work that through into our proposal, because we know who they are? We're not seeking additional collaborators necessarily at this point. We know who those collaborators are.
The tool is primarily meant to be if you're seeking additional collaborators. So I would say in your case, that might not be the most appropriate mechanism for that. One thing I will say, you know, just as it relates to collaborations, and I tried to explain this in the grant seekers information session, but just so it's clear, I'll reiterate it here. As the fiscal agent for the grant really is responsible for maintaining the fiscal adherence of those additional collaborators. And there's two ways you can do that. And we have different grant awards doing it in different ways. One is that you can procure services, and then those can become contractors. So even as you're filling out your budget, you need to really be thinking strategically about how you're going to do that. Now, if you're going to procure services, you may have a procurement policy that dictates that you need to put something out for requests for proposals or something like that. If you're bringing a collaborator in as a partner and it's not contracted, but they're a partner in your grant, such as like a true partner in a collaborative grant that's not procured services, then that partner is likely going to have to fill out their own budget each month. And I would say it would be wise to even do your original grant proposal with 3 separate budgets. So maybe create a different tab for each organization in the budget proposal, because then each month, each organization needs to fill out a budget and submit their evidence of expenses in a separate document so that we can easily see which evidence is associated with which budget for each of the partners in that application. We can do it either way. It's a little bit easier for us if the services are procured and contracted and completely managed by the fiscal agent, but we understand there's certain situations where that's not the best way to do it. So we are try to be flexible to allow for both options and currently manage grants with both options.
Thank you. That's really helpful.
Okay, any other questions? Has anybody had a chance to look at the funding resources on the website? Have people watched the information videos? Have people found those helpful and clear?
So far, so good. Yes.
Great.
Yeah, I've watched and I thought it was very clear. Nicole, you were great. Jason, you're always great.
Yeah, I was going to say, I mean, okay.
Come on.
Thanks for
Sorry,
making
just try
such a bold statement, Lori. I appreciate it.
I'm new, so that's nice for you to be nice to me. Like, you've been nice to Jason for a while, so that's fine.
There we go. Nicole has asked also, has anybody actually gone into the grant portal and started looking at the application, the new applications for this year?
Yes.
Okay.
I've not done that yet.
Any
feel
questions
free-
related?
Oh, sorry. I was gonna say, feel free, so the website is on there, but if anybody has any questions specifically for me of things, I will put my email in here, so feel free to reach out and clarify, ask any questions. This is a new process, so we are welcoming questions.
I haven't compared it enough to last year's application to be able to tell how much easier the continued funding application really will be yet. But I did look at it and just kind of read through it, quickly. It seems like a lot of the information is the same.
Yes, it is, and the thing that's good is some stuff has been taken out, so a lot of it is the same, so you'll know the answers, and you can also copy over, so that feature is on, so if you want stuff from your old application and carry over, you can do that. Same thing, if anybody is interested in filling out the abstract is the same, so if you fill out the abstract in your application, your abstract is approved to complete an application, it'll also copy over, so you won't have to type it in 2 times. We're trying to make it as simple as possible in case nobody noticed the underlying mission or objective here, so.
Well, we will have a second question and answer session Thursday, so we can leave it open for a couple more minutes if anything comes to mind, but we can also cut this short if no one has additional questions. You, again, are welcome to register for the Thursday session, ask additional questions. These are meant to capture those really obvious things that people might initially react to. I know they're pretty quickly here from when the application opened, but we are also going to keep a log of question and answers on the website. So if we do receive additional questions, for example, from an organization privately, and we feel that that would be of value to everyone, we can post that on the website so that everybody has access to that information. But we're also just as available to answer them through email as you're going through your applications. And certainly if we see the need to get on a phone call with you to talk through something, we can do that as well. We do provide direct technical assistance to make sure applicants are able to fill out quality applications. And just so all of you know, we do not make the decisions on these grants. The mental health board members do that. So we have a little bit of separation in this process to provide the applicant assistance to get a quality grant and allow the board members to do their role of actually reviewing, scoring, and making funding decisions. Okay, last call for questions. If anybody has one more, otherwise we're going to wrap up today's meeting. And there is a link for Thursday's meeting, both on our website on the funding resources page, and also it's shared in the chat if you're on the call today. Is there a specific definition of what community support is? Yes, there is a very specific definition of that. It's not a simple definition, but it is a clear definition, and the best place to find that is in the 3-year strategic plan. There is a description of the community support system model and each of the components of it. So I would recommend, especially if you're filing a grant for the first time, you really want to take the time to look at that strategic plan. Even though we've highlighted this year some specific funding gaps, Those are not independent of the community support system model. Those are funding gaps that we believe still exist within the community support system model, within the 6 priorities that had previously been identified. So your foundational document for all of this is that 3-year strategic plan, which statutorily, dictated by state statute and the Community Mental Health Act, mental health boards in the state of Illinois are required to fund according to a 3-year strategic plan. So it's not just an idea we came up with. It's something all the mental health boards do. So please take the time to read that one. If you have any questions about anything in it, let us know. But there are very nice descriptions of the priorities, the different types of outcomes, and the target populations, as well as the community support system framework. Okay. One last chance then. Any final questions? Oh, there we go.
Thank you.
Okay. Thank
No
you.
question, just thank you.
All right.
Thank you.
All right. Thanks, everyone. We'll see you Thursday if you jump back on.
Okay,
Bye.
I know.